So here's our group presentation with the title Antihyperlipidemic Effects of Ginger Extracts in Alloxan-Induced Diabetes and Propylthiouracil-Induced Hypothyroidism in Rats. Antihyperlipidemic is a drug that acts to prevent or counteract the accumulation of lipids in the blood. Some of you are still wondering why albino rats always used in research. Simply because albino rats eat any food typically eaten by humans and they have a similar digestive system to humans. Diabetes mellitus is a metabolic disease that causes high blood sugar. With diabetes, your body either does not make enough insulin or cannot effectively use the insulin it does make. There has a two type of diabetes, type 1, which is the little or no insulin. Without insulin, sugar accumulates in the bloodstream rather than entering the cells. As a result, the body control cannot use this glucose for energy, while type 2 diabetes do not respond to insulin. Ginger extract has a big role in treating diabetes. The fresh and dried rhizome of ginger is widely used in traditional medicine. We have studied that the ginger extract on alloxan-induced diabetic rats, particular reference to the involvement of serotonin receptors on glycemic control. Treatment with ginger extract produced significant increase in insulin levels and decrease in fasting glucose levels as well as the serum cholesterol, serum triglycerides, and blood pressure in diabetic rats. The first step was to separate 8 rats into a regular group called Group 1 and divide rats into two groups to induce hypercholesterolemia in two ways. Diabetes mellitus induction. In 12 hours of fasting rats, diabetes was induced by a single intraperitoneal injection dose of 250 mg per kilogram of alloxan monohydrate body weight. After injection, animals had free access to food and water. After 6 hours of injection, rats were given 5% glucose solution overnight to avoid hypoglycemic shock. Diabetes status was assessed after 72 hours of alloxan injection by measuring non-fasting plasma glucose levels. For studies, rats with plasma glucose levels above 250 mg per deciliter were accepted and considered diabetic. Induction of hypothyroidism. This was caused by the addition of 3% propylthiouracil to drinking water for 21 days after calculation and approval of serum low-density lipoprotein levels for animals with low-density lipoprotein levels above 22 mg per deciliter. Alloxan-induced diabetes in rats, which induce diabetes while producing reactive oxygen species, leading to demolition of pancreas B cells. The primary cause of a number of long-term complications of diabetes is chronic hyperglycemia. Protein glycation is the most important source of free radicals. It is led by hyperglycemia. According to the amount of evidence, it is now known important contribution to the progression and complication of diabetes is done by free radicals. Compared to the control groups, the amount of total cholesterol and low-density lipoprotein in the serum of rats treated with ginger extract were shown to decrease. Previous extracts have also been able to cause LDL levels to decrease to similar levels, as compared to the normal group with atorvastatin 10 mg per day having the same effect. Our body needs cholesterol to protect its nerve and make a healthy cells and hormones. Low density lipoprotein or the bad cholesterol, it collects wall of your blood vessels, raising your chance of health problems like heart attack or stroke. Good cholesterol or the high-density lipoprotein is a healthy level that protects our heart to any discomfort. With more than 190 mg per deciliter, it is considered that the patient, human or rather albino rats, has a very high bad cholesterol. Therefore, we conclude that antihyperlipidemic drugs reduce serum composition of various lipids and cholesterol levels. These medications are also referred to as lipid-lowering agents, which provide effective treatment for hyperlipidemia or elevated blood lipid levels. Cholesterol medicine can also help to reduce the bad cholesterol, which raises the risk of heart disease.